Welcome to the Explainer. Today we're talking about something that could literally save your life. We're decoding the urgent SOS signals your brain can send through your eyes. These are warnings that can show up before a major stroke hits. And just to be clear, this isn't about general eye health. This is about recognizing a full-blown neurological emergency in disguise.
So here's our game plan. We'll kick things off with why this is so incredibly critical. Then we'll get into the fascinating connection between your eyes and your brain. We're going to pinpoint the exact visual warnings to look for, figure out how to tell if it's an eye issue or a brain issue, and then wrap up with a rock-solid emergency action plan.
All right, let's dive right in by understanding the stakes, because when we're talking about a stroke, every single second counts.
And just to give you an idea of how common this is, strokes are a massive problem. In Japan alone, they hit around 200,000 people every single year. So this isn't some rare thing, it's a widespread and very serious health crisis.
And when a stroke does hit, a clock starts ticking, a really loud one. Doctors call it the golden time. This supercritical window of about 4.5 hours to get treatment that can actually bust up the clot and stop permanent brain damage. If you miss that window, well, the consequences can be devastating and irreversible.
So how in the world can your eyes warn you about a problem that's happening deep inside your brain? Well, it all comes down to the connection, the plumbing, if you will.
You know, as the ophthalmologist Dr. Takahashi puts it so well, the retina is like the exposed brain. Think about that. It's the only place in our entire body where a doctor can look directly at our blood vessels without making a single cut. It's an incredible, unique window into the health of our entire vascular system.
This slide shows us exactly why that is. See, the main highway for blood flowing from your heart up to your brain is called the internal carotid artery. But on its way up, it sends off this really important exit ramp, the ophthalmic artery, that feeds your eye. So a tiny clot traveling up this main highway can either take that detour into the eye, giving you a visual warning, or it can just keep going straight to the brain.
And this brings us to a super important idea, the TIA, or mini stroke. Now, this is when a clot temporarily causes stroke-like symptoms that then, poof, disappear. But don't let the name fool you. There is nothing mini about it. It is a massive, massive warning sign. And get this, about a third of people who have one get that warning through their eyes. Okay, now for the specific clues you absolutely cannot ignore. I want you to remember two key words for everything we're about to cover: sudden and painless. The number one sign is often described as a curtain literally falling over the vision in one eye. It might only last for a few minutes, and then it's gone. Other big ones are sudden double vision, a droopy eyelid that shows up with a smaller pupil on that same side, or suddenly losing a whole chunk of your vision, like everything on your right side just vanishes.
So how do we figure out what's going on? This is where it gets really interesting. The specific symptom can actually tell you whether the blockage is in the eye itself or if it's in the brain.
This is probably the most important distinction we're going to make, so listen up. If the vision problem, like that dark curtain we talked about, happens in only one eye, the clot is probably in the eye's own artery. That's a warning from the eye. But if the problem affects both eyes at the same time, like losing the right side of your vision in both of them, then the blockage is almost certainly in the vision processing center of your brain. That's a warning from the brain. Ignoring any of these signs is like playing with fire. Seriously, even if the symptom completely goes away. Just having a TIA means you have about a 10% chance of having a major, life-altering stroke within the next 3 years. It's a dress rehearsal for a disaster.
And here is the absolute crucial takeaway. If any of these sudden eye symptoms show up along with other classic stroke signs, like a crooked smile, slurred speech, or weakness in an arm, it's not a warning anymore. You have to treat it as an active, life-threatening emergency that is happening right now.
So you're probably wondering, what's causing these dangerous blockages in the first place? Well, it usually comes down to underlying conditions that are damaging your blood vessels over time. The main culprits probably aren't going to surprise you. High blood pressure, that irregular heartbeat known as atrial fibrillation, diabetes, and high cholesterol. And of course, smoking is a huge risk factor for pretty much all vascular diseases. Now, what's amazing is that doctors can actually check for this risk with a super simple, totally non-invasive test. An ultrasound of the carotid artery, right here in your neck, can show if there's dangerous plaque building up. In fact, the official guidelines recommend getting this test done within 48 hours of a suspected TIA.
Okay, this brings us to the most important part of our explainer, your action plan.
because knowing all this stuff is great, but it's totally useless if you don't know what to do in that critical moment.
If you or someone around you has any of these sudden vision changes, I want you to follow these 4 steps immediately. No hesitation. 1. Note the exact time the symptoms started. This is essential for the medical team. 2. Call for an ambulance. Do not wait, and do not try to drive. 3. Clearly describe everything you're experiencing. And 4. If it's safe to do so, use your smartphone to record a quick video of any visible symptoms, like a facial droop. It can be incredibly helpful for the doctors.
Of course, the best strategy of all is always going to be prevention, right? That just means actively managing those risk factors we talked about. Work with your doctor, get your blood pressure under control, eat well, get some exercise, and quit smoking. It all makes a huge difference.
So just remember, these sudden, painless vision changes aren't just weird eye problems. They could be your brain's last-ditch effort to send out an SOS before a catastrophe. They are urgent, potentially life-saving messages. Which really just leaves us with one final thought. Your eyes are talking. Are you listening?